Welcome to this month's edition of Outlook Video, your nationally recognized award-winning show for gay, lesbian, bisexual, and transgender communities. I'm Roberta Gonzalez-Gregg.
And I'm Tom Smith. In our first segment for this month's show, I'll be interviewing Dr. Lawrence McGlynn, MD, a clinical instructor at Stanford University. I'll be asking Dr. McGlynn about his role as director of the federally funded Stanford Santa Clara Methamphetamine Task Force and its mission to reduce methamphetamine usage and new HIV infections in Santa Clara County. Okay, Roberta, start your stopwatch and let's see how fast I can get into position for the Larry McGlynn interview. I'm Tom Smith, and I'm pleased to have with us Larry McGlynn, MD, clinical instructor in the Psychiatry and Behavioral Science Department of Stanford University. A native of San Francisco Bay Area, Larry McGlynn is a graduate of Harvard Medical School and now serves on the faculty of Stanford University. He sees patients in Stanford's Positive Care program and directs the Stanford Santa Clara County Methamphetamine Task Force. Dr. McGlynn believes that by reducing methamphetamine use in Santa Clara County's MSN population, that is, men who have sex with men, we will begin to see a reduction in new HIV infections. The task force has recently been awarded a $200,000 grant to produce a public awareness campaign to increase awareness of the risks of crystal methamphetamine use. Dr. McGlynn, welcome to our show.
Thank you very much for having me.
Let's get right to it. Methamphetamine, we know, is a very bad drug. Why is it so toxic to the gay community?
Well, the thing about meth is it's actually quite toxic to many communities. The thing with meth is that it has a propensity to cause a very big increase in sexual desire. We can actually measure sexual desire, pleasure, by looking at a chemical in the brain called dopamine. So if we think about dopamine increases in a person, let's say when they're going to have good food or sex or smoke a cigarette or drink some alcohol, we might see the dopamine increase by about like 200, 300% above our sort of normal rate of dopamine. Meth competes with cocaine in that sense. Cocaine may increase dopamine by about 500%, but meth, when we think about this, 1,500%.
So it just goes right off the chart.
Way off the chart. So we're competing with something here in our community with methamphetamine, which is creating this incredible amount of pleasure, which along with it creates this amount of impulsivity. So pleasure with impulsivity leads to unsafe sex and ultimately, unfortunately, new HIV infections.
So you've seen a strong correlation between methamphetamine use and unprotected sex in the men who have sex with men community.
Particularly when we look at our new patients who come to our clinic, new infections with HIV, and the thing that seems to be in common with all these people is that they've been using methamphetamine. There are still those people who don't use meth, who have unprotected sex, maybe new immigrants who don't know a lot about HIV, but by and large, the men who have sex with men who use meth are most of our new patients.
And you brought up something interesting we were talking earlier today, is that it's not just gay or bisexual men, but men who identify as straight, who will get the rush from the methamphetamine and have very intense sex with other men. And then there's a psychological component that they would have to deal with. Can you talk about that?
Absolutely. Again, with men who use methamphetamine, they're going to have this incredible sexual drive, much more so than what women would get with methamphetamine. So men get this incredible sexual drive. If they're used to having sex with other men, that's fine, they're going to have sex with other men. However, we'll find men who have never even had the idea of having sex with other men, find themselves in a situation where meth is being used, other men are there, other men are having sex, they start participating in sexual relations with other men. What they deal with afterwards when they come off of the meth, which in itself comes with depression and sometimes psychosis, anxiety, is they find themselves questioning their own sexuality. What did I do? I'm not gay. They may have anger towards themselves, they may have anger towards the people they had sex with.
Wow, interesting. The $200,000 grant that you have, who is the audience? How do you propose to reach them?
Well, it was awarded to us. We competed with other agencies who are looking at alcohol, tobacco, other addictions in Santa Clara County. And we made the argument that because of methamphetamine, we're seeing new HIV infections. So the Department of Alcohol and Drug Services of Santa Clara County listened to us, and they were very generous with us, and they provided us with the award. They, though, advised us, you need to focus your campaign. We can't target it towards everybody, towards women who use meth, towards teens who use meth, towards whichever population using meth. They said focus it, and we focused it on the population we knew the best, which were men who have sex with men. So that's our focus, that's our target.
Can you quickly explain hooking up and PNP and some of these other terms that...
Terms that we hear commonly in our clinic. Hooking up really means sort of meeting other people. In some cases, it just means to have sex. In other cases, it might mean to have sex and perhaps with drugs. P&P stands for party and play. And this is something we see commonly on the internet, which is a very, very common place for people to find sex and drugs together. So they'll go onto any website that may say, you know, you're trying to find another man to have sex with. Someone might say, I have favors, which means I have drugs. P&P, party and play, which typically talks about crystal methamphetamine. Come on over, we'll have sex. And then this is ultimately which leads to the sexual encounter.
Great. Believe it or not, we are out of time, and we can continue talking about this. But for those viewers who want more information, please look at the website and the phone number. And we want to thank you, Larry, for being on the show. And
thank you very much.
We'll have you back, hopefully, very soon.
That would be wonderful.
Thank you.